Hello, my name is Dr. Patricia Zemantic, and I am a postdoctoral fellow in the Early Intervention Program at the Munroe-Meyer Institute. Today, I'm going to talk to you about autism spectrum disorder, or ASD. We'll talk about what autism spectrum disorder is, when you should connect with a professional, and what services look like. In the past, we used to give different labels to individuals who had difficulties with social communication and social interaction, as well as certain patterns of interest, activities, or behaviors. Today, we recognize that these individuals all have some of the same types of concerns, but may require different levels of support in order to be successful. So we consider all of these individuals as having autism spectrum disorder, or ASD. Individuals with autism spectrum disorder have difficulties in the area of social communication and social interaction. This might present as difficulties with things like eye contact, maintaining relationships, engaging in back and forth conversations, as well as using and understanding gestures. Individuals with ASD also have certain patterns of behavior, interests, or activities. This may present as a strong need to adhere to certain routines, even if they're not functional. For example, you might have a kiddo who kisses mom, kisses dad, kisses their stuffed bunny, and then goes to sleep. You don't need to do all of those steps in order to go to sleep, right? So it's not necessarily functional. But we see that sometimes if these routines do get disrupted, then the kiddo is not able to sleep at all because they weren't able to complete their routine. We can also see over-responding or under-responding to certain aspects of the environment. For example, being super sensitive to sounds that most people wouldn't even notice or be bothered by, like the hum of a refrigerator. We also see intense special interests. So, for example, you might have a kiddo who's really interested in outer space, and they may not be particularly motivated to have conversations about other topics. So, when you try to redirect the conversation, they may continue to try to go back to that special topic of outer space. We can also see a range of motor behaviors like hand flapping, body rocking, and toe walking. While individuals with ASD may face certain challenges, many of their differences can actually serve as strengths. For example, Temple Grandin is an adult living with ASD, and she's currently a professor of animal sciences at Colorado State University. She often describes how she's been able to leverage her differences as strengths and become more effective in her field. There's even a movie about her life. There are different ways to identify autism spectrum disorder, so we're typically talking about either a medical diagnosis or an educational verification. The methods used to identify a medical diagnosis and an educational verification may involve different criteria, different tools, different types of professionals, and really in each of these evaluations, we're asking different types of questions. For a medical diagnosis, we're interested in determining whether the child has ASD and what services they may need. That medical diagnosis then opens the door to private services like speech and applied behavior analysis. In an educational verification, we're asking whether the child has ASD and whether they need school-based services in order to function in that environment. And this evaluation is typically completed by those school-based professionals. You could have a child that has a medical diagnosis of ASD, but they don't end up qualifying for that educational verification of ASD. This could be because they are doing just fine in that school-based setting and they don't really need school-based services in order to function well there. This is how a child could have a medical diagnosis of ASD and not an educational verification. Again, because these are two different evaluations, you can have one and not the other. You also don't need to have a medical diagnosis of ASD in order to access school-based services or in order to have an educational verification of ASD. When should you connect with a professional? Well, you should connect with a professional whenever you have concerns, whether they are general developmental concerns, autism specific concerns, or immediately following a diagnosis. Really, a professional can help you navigate each step. Now let's talk about some interventions. So early intervention is the term that we often use to describe those services that are available for infants and young children with developmental delays and developmental disabilities, as well as their families. And these services can include things like speech therapy, physical therapy, and many others based on the child's needs and the family's needs. Now, typically these services are offered in the child's home and involve the caregivers, and they're delivered for a couple hours per week. Early intervention can have a really significant impact on children's development, and it can help improve their functioning across a variety of settings, so including home, the community, and even school settings. There are public early intervention programs available in every state, although they do have different names. These programs are typically provided at no cost or at a very low cost to families. Now, in Nebraska, we have the Early Development Network, and in Iowa, we have the Early Access Program. For individuals with ASD, early intensive interventions based on applied behavior analysis are recommended. ABA is a systematic, evidence based approach that uses the principles of behavior to increase communication skills, adaptive skills, and social skills, as well as reducing some problem behavior. ABA is considered intensive, meaning that these services are delivered for many hours per week, so 20 hours a week or more. Child to staff ratios are kept low, so we typically see services delivered 2-on-1 or 1-on-1. ABA does involve a variety of professionals, so you might hear about folks like board certified behavior analysts, registered behavior technicians, speech language pathologists, and many other professionals. Most commonly, ABA is considered a private service, and it's delivered either in a clinic or in the home setting. And it's a service that occurs outside of a school-based setting or outside of that publicly provided early intervention programming. You might wonder, does my child need this level of intervention or service? And really talking with a provider can help you figure out what's best for your child. Although we emphasize early intensive interventions, we can apply many of the strategies and approaches that we use with younger children to individuals with ASD across the lifespan. So just because your child didn't get early intervention services doesn't mean that there's not a lot of services available that can really help. There are a number of interventions designed specifically to promote social skills in individuals with ASD across the lifespan. For example, the PEERS curriculum developed by Dr. Elizabeth Lageson goes over practical social skills for children, adolescents, and young adults with ASD. Here are some key takeaways. Autism spectrum disorder includes symptoms in two main areas, so social communication and social interaction, as well as patterns of interest, behavior, or activities. Remember, a medical diagnosis helps you access those private services, while an educational verification helps you access those school-based services. Your child does not need a medical diagnosis of autism spectrum disorder in order to have an educational verification of ASD. Although early intensive interventions are recommended for individuals with ASD, there are interventions available across the lifespan to help with autism symptoms. Thank you for your time, and I look forward to hearing your feedback. Take care.